Respiratory system. How does it work and what are the problems of this system? So, respiratory system is responsible for supplying oxygen to every cell of our body. Let's look at the key terms of this system. The stars of this system are our lungs. That's two sponge-like organs located on either side of our chest. Now let's look how does our air enter the lungs. So let's look at the picture. We use our nose or mouth for breathing. Also we have sinuses and then pharynx, larynx, trachea, bronchial tubes, and our lungs. Into the lungs we have bronchiole or bronchioli, if we are talking in a plural form, and they enter the air sacs, which are called alveoli, right? Alveoli. Now let's look with you at the process of breathing. So, what is the job of all this system? To inhale, breathe in oxygen-rich air, and exhale or breathe out filled with carbon dioxide. As a doctor, you can give an instruction to your patient. Breathe in, breathe out. Breathe in, breathe out. When you would like to listen to the chest, to the work of the lung of your patient. Remember this word. Breathe in, breathe out. Inhale, exhale. What happens when it doesn't function as it should? Let's delve into some common respiratory disorders, their symptoms and treatments. First up, bronchitis. This condition involves inflammation of the bronchi, those tubes that carry air to and from your lungs. The main symptoms are a persistent cough, often with mucus, shortness of breath, and chest discomfort. The best course of action in case of bronchitis usually involves rest, hydration, and sometimes medication to ease symptoms. Next, let's talk about asthma. This chronic disease causes airways to become inflamed and narrow, leading to wheezing, shortness of breath, chest tightness, and coughing. Asthma management typically includes inhalers to open airways, avoiding triggers like dust or pollen, and sometimes oral medications. Moving on to emphysema, a condition that gradually damages the air sacs in your lungs, making it progressively harder to breathe. The main symptoms are a gradual onset of shortness of breath, chronic coughing, and a reduced ability to exercise. Treatment often involves smoking cessation or quitting, medication to relieve symptoms, and sometimes oxygen therapy. Being familiar with these disorders and symptoms in English, you can respond quickly and effectively if someone experiences these symptoms. So keep this information in your back pocket. You never know when it might come in handy.